So I am delighted to be here today. I'm Kelly Garcia, as Courtney said. I'm the director of the Iowa Department of Health and Human Services. It's so wonderful to see a room full of friends and colleagues and deeply devoted individuals to this subject. I came to this journey, as Courtney said, right? I have a somewhat odd career, but my journey to health and human services includes being centered and of course, becoming a parent. And I came to be a parent later on in my own life after real struggles with infertility, some endocrine system issues in my own body that really made my journey quite high risk, including a blood clotting disorder. I had phenomenal care and ultimately an emergency situation that resolved with a beautifully healthy baby who's named for my OBGYN. My son's name is Oliver. Dr. Oliver delivered him. And so this topic area, not only from my own personal experience and journey, and for so many women who share a similar story of struggle or loss, is deeply centered in the work that we're doing as we bring these agencies together. And you're gonna hear from a number of team members, our own and colleagues that we work with really closely throughout the day around those issues. So this week, in fact yesterday, marked 4 years since the Garcia family packed up our car and our 2 little ones and drove up I-35 to move here. It has been an absolute tremendous journey, and I would do it all over again, despite the significant challenges that the last 4 years have brought. We are in a space right now in our alignment of our new agency that really centers family well-being and maternal health care and women's health care across the entirety of the life spectrum in a way that I think is fresh and new and deep and meaningful in our state. Through our Medicaid program, we cover more than 40% of the births, actually just shy of 50%. And later today, you'll hear from our state Medicaid director, Liz Matney, about a shift in our philosophy and how our programs are really taking population health metrics and the work that we do on the public health side of our department and threading that through our Medicaid program and working directly with our managed care partners on how to improve birth outcomes. Not only for individuals who utilize Medicaid services, but when we do that work, given the number of women we insure, we do that work for all women in the state. You'll also hear about the detailed ways that we're working to identify and address root causes of maternal mortality in our state and strategies to improve these outcomes. With the force of those folks alone, we have major levers that we can use across our system to, better outcomes for all women in Iowa. And we're lucky because we have so many other phenomenally talented partners. I see Dr. Hunter in the back. I have not landed my eyes on Dr. Radke yet, but incredible partners that we work with across so many partners in state government and in extensions of our team. So I'm going to highlight a few other really key events that we have launched over the last several years that I really do think changed the landscape of the work we're doing centered in maternal health care. And first, we have successfully implemented the safe reduction of primary cesarean birth, and we've made incredible progress in this area through our AIM bundle strategy. In our most recent strategy to completion, we had 100% participation of Iowa's birthing hospitals in the obstetric hemorrhage safety bundle. And just last month, we began working on improving recognition and treatment of severe hypertension during pregnancy and the postpartum period. Incredible work by an incredible team that has been a long time coming. And let's just remember that this work was all done and launched in the backdrop of a global pandemic. So I think that's really something to be proud of. This work is truly making an impact. And the partnerships continue to come online. We've also focused on how we can support rural moms in ensuring they have access to the same healthcare as women living here in the Des Moines metro area or other more populated areas of the state. We have grant funding focused on improving outcomes for maternal and infant health, and real strategies around how to make sure that that funding remains stable, long-term, and a deep investment. We have QI initiatives with birthing hospitals focused on best practices, and other funding and work focused on maternal health for women with substance use disorders. And just Friday, our federal partners approved a significant investment across all of Iowa's hospital systems. Their quality outcomes focused on a variety of different impact areas, but at the cornerstone of that work is maternal health. Director Matney will tell you a little bit more about that. I told her on the way here that I was going to give a little teaser, but it's a really phenomenal investment in the state and something that really does change the landscape of the way we fund quality initiatives in Iowa. So there is so much work being done, but there's still so much to do. We are focused on the right problems. I think we know what the problems are. We've got a number of strategies and solutions in play, but we certainly have, and so many of you are at the table with us in the arena doing this work all day, every day. I see with us a North Star vision where we really can make the outcomes that we've so long talked about. So thank each and every one of you for being here. Thank you for showing up to do the work every day, but for being here, as Emily said, to come away with solutions, not just talking about problems. This schedule was so thoughtfully planned, and I think a long time coming when I talked with Janet about the original idea of this symposium. So Emily, thank you for the incredible partnership for the work today, and I'm delighted to be here.